My name is Jeremy Stone. I'm a physician in cardiology at UNMC. I did my training here actually at UNMC for residency in internal medicine. Then I went on to the University of Chicago for my cardiology training. So I chose cardiology pretty early on in my internal medicine residency. When I was working at the VA. One of the things that initially drew me to it was because it was very dynamic and exciting. Patients can come into the hospital and be very sick, and you can do some pretty miraculous things to make them feel better and very quickly. And as I went further on in my training, it became clear that it's not just the exciting part of it. You get to get involved in preventative medicine with patients and really get to know them and really help impact their lifestyle so that you can decrease the risk of having heart attacks or developing heart failure down the line. And that turns out to be probably the most important part of cardiology, is making sure that you intervene early so that patients can live longer, live more quality lives. And that, in the end, became the thing that drew me into cardiology the most, because that seemed the most rewarding. So when I'm not working or studying or reading, I'm really into music. I play the piano, I compose music. I have some music out there on the internet that takes up a lot of my time. I enjoy hanging out with friends and family, going to the gym, and also just movies and music in general. In my residency and through fellowship, I had the idea that being in an academic center would be the right place for me, because you have so many people around you to bounce ideas off of. You really are at the cutting edge of the best, most up-to-date treatments, and so you really have the right tools to really treat a patient exactly how they need to be treated, individualized treatments for people, and you have the technology to really make sure that patients are getting the right care that they need. And then because you're at an academic institution, if you have a complex problem, you have a lot of people, a lot of subspecialists to talk to and refer to the right people. And especially at Nebraska Medicine, University of Nebraska, everybody's very collegial, and so you have really open doors to talk with people and get patients in where they need to be seen.